The idea of doing an IVF treatment for many people conjures up the idea of several weeks of injections, lots of scans, tests, a generally extremely unpleasant and stressful experience. And I'm happy to say that in recent years IVF has become a lot more simple, and the treatment itself really lasts no longer than your normal cycle. But it perhaps is helpful to understand a little bit what happens once you register to go through an IVF cycle here at Complete Fertility, and that's what I'm going to talk about in this short film. So once you've booked in for a cycle, you will be invited up to the clinic to see a doctor in one of our consultation rooms, who will go through the treatment with you in detail and focus specifically on aspects of the treatment for which you need to give your express written consent. This includes aspects like how many embryos we're going to transfer. If we have extra embryos left over, will we freeze them in? Do you want us to do that? And the use of specific fertilization techniques. And these will be gone in detail before we ask you to give your written consent for this. At this appointment, we'll also look at your past history and assess the test results you've had and identify the individual stimulation protocol which is most suited to you in our aim of getting sufficient eggs to give you a nice chance of pregnancy, but not so many eggs that we get a hyper response or possible side effects from the treatment. So this is an important interview with a doctor, and is attached to another consultation which you will have with a nurse, who will go through more of the practical aspects of the treatment. For instance, how do you do the injections? And you'll be given instruction in the injections prior to being sent to your prescription, personal prescription of the drugs that you will use for your IVF treatment. These drugs will be delivered to you at home, and the specific prescription will have been written out by the nurse or the doctor for you. You'll receive these at home, and they'll be ready for you as you wait to start your cycle. When you're ready to start your cycle, you just give us a call. How will you be ready? Well, with most of our stimulation protocols, you can kick off your treatment when you get your period. And when you get your period, you call the unit, and we will arrange for you to come up for what we call a baseline ultrasound scan. This is a scan that lasts just a couple of minutes, at which the nurse will look at the monitor to see whether or not there are any aspects of the ovary or the uterine appearance which we feel could be better before we start. For instance, are there any cysts or anything which we should wait to disappear before we start treatment? Now, in most cases, everything will be fine, and you'll get the go-ahead from the nurse to start injecting one of the hormones, usually the FSH hormone, on that day of treatment or the day after. Over the next 2 weeks or so, you will then be injecting hormones. You'll be injecting two types of hormone. For the first week, you'll just be injecting FSH. Now, this is a hormone which stimulates the ovaries so that they produce follicles, which hopefully will contain the nice mature eggs that we will be able to remove some 2 weeks after you've started stimulating. Now, because we're stimulating lots of eggs to grow, there is a risk, of course, that you may ovulate prematurely. And we don't want that, because if that happens, it means we've lost the eggs and we can't get them at oocyte pickup. So after a week, we'll ask you to start a second hormone, cetrotide or something similar, which acts to prevent premature ovulation. It means that when we go and get the eggs with our surgical procedure, the oocyte pickup, they'll still be there for us to get. After around a first week of stimulation and injections with eggs, we'll ask you to come up for a second scan. And during the scan, which will also be performed by a nurse, we'll see how the follicles are growing under the influence of the hormones you've been injecting. It may be that the nurse will feel an adjustment to your dose is necessary, and she will discuss this with you. Normally, she will be able to advise you specifically at that time, if a dose is necessary, what it should be. But what we do here at Complete is every lunchtime, the team gets together to discuss the scans that have been happening that morning, and so that we can all agree the protocol and the plan for the next few days. Now, often the nurse will not need to inform you of that because she'll already have advised you what to do. But if there is a change of plan, we will of course call you that afternoon. So that you now enter a period of around about a week, in the second week of your cycle, where we start monitoring a little bit more intensively. So after your second scan, you may be asked to come back 2 days, 3 days later to see how things are developing as we move towards the time when we're ready to do the pickup. And normally around about after 2 weeks of injecting, we'll see that things are ready to go and that the eggs are almost ready to be removed. Now, At that point, you will be asked to take one more injection. And that injection is an injection you take late in the evening at a specific time which the nurse has told you. And 36 hours after that, you'll be here at the unit for us to remove the eggs, which will now be fully ripe as a result of that hormone injection. You'll then come up, you'll be given a time to come up to the unit, often quite early in the morning, and you will be met by a nurse, and you'll be seen by an anaesthetist and the doctor who's been going to do the pickup when we remove the eggs, in order to prepare you for a short procedure which we normally do under light sedation, and most of our patients have no recollection or suffer any pain during this. During the pickup, we will pass a small needle into the ovary under ultrasound monitoring, so we can see where the ovaries are. We put the needle into each follicle and we aspirate the follicle. We take all the fluid from that and we pass that fluid through to our colleagues in the embryology lab, and they go looking for the eggs. And at the end of the procedure, we'll know how many eggs we have, and we will tell you that as soon as you've woken up and come round. After your pickup, you'll come into a little room where you can recover, and normally after about an hour or so you'll be feeling fine and well enough to go home. And while you're waiting, we'll bring you a cup of tea, make sure you're feeling comfortable. The nurses will obviously want to be happy that you're fit and well to go home, but normally that can happen, as I say, within an hour or two of completing the procedure. You will then be asked to start another form of hormone, not an injection this time, but a gel that just goes into the vagina, and that supports the early embryo in its role of implanting and helps support the lining of the womb as the embryo implants. But this is something you take initially for 2 weeks until you know whether or not the pregnancy test has become positive. So what I've talked about is a period of around about 4 weeks, from the first day of your period, when you call us to say you're ready, and we bring you up for a first baseline scan, to 4 weeks later, when hopefully we'll have a positive pregnancy test. Despite our milder stimulation protocols in modern IVF, IVF can still be stressful. And that's why we have a counsellor attached to our unit who's a specialist in fertility counselling, and she's available to help support you through the treatment. Now, some couples feel that this is helpful at the beginning, and others feel it's very helpful afterwards. But at any point in the cycle, you can make an appointment to see our counsellor.